They just come on?
Or no, you just start talking. You won't be able to see them.
Oh, no, but I won't be able to hear them, right?
No.
Oh, I thought this was interactive.
They'll be able to send in questions.
They're sending questions typed?
Yeah.
Uh-huh. Okay. Well, hello, everybody, if somebody's there. I'm Dr. Jaana. I'm a gynecologist, and I'm here to answer any questions about menstrual issues that you may have. I would like to have my piece of paper, though, if I'm going to just be talking, and I don't have a piece of paper, I just have it on my computer, so how do we do that?
You can pull it up.
Can I just pull it up? Do you think it'll be on the side here? I guess I could do that. So bear with me for a moment. If you have any questions, you can send them in. In the meantime, I will look for my document here. Okay, so I have to ask my helper here. Where do I see the questions when they appear? You'll be sending it, and they'll be in writing.
Mm-hmm.
Okay. Have you sent me anything yet? Or?
Only the ones you have by email.
Oh, okay.
And then when you want to see more, there'll be
questions and answers.
Yeah.
Very good.
And so
Oh, good. Okay. All right. So hello, everybody. I don't know if anybody's out there, but if you are listening, feel free to ask me anything. I can't promise I can answer it, but I try. I have over 30 years experience with handling women's menstrual problems. So feel free to ask anything. And if you feel shy about it, you can always say, I have this friend who has this problem. And then it won't be so difficult. I have been given a few questions ahead of time, and so I can start perhaps by talking about those because they're quite common, so you may benefit from just listening to that as well. I have a question here about a few women in my family have a disease called endometriosis, and I would like to know some of the most common symptoms and what causes endometriosis. This is a disease that can make your periods be exceptionally painful. And what it really is that it's the lining of the uterus, which is called the endometrium. That tissue, the same tissue can be found on the outside of the surface of the tubes, the ovaries, the uterus, very commonly in the back of the uterus, between the uterus and the rectum, and sometimes also on the surface of the bladder, in the front part of the uterus towards the bladder, basically anywhere in the pelvis, and also occasionally in remote locations. And nobody really knows exactly what causes it. It's probably genetically determined and arises out of some kind of embryonic tissue that's already there from the start. There is a certain familial tendency, so if you have endometriosis, it could be that your mother or your sister also has it. And what happens is that every month when you bleed, those little bits and pieces of tissue also bleed. There's no exit for that blood, so it just gets absorbed, and there's inflammation surrounding that. And as a result, the tissues get sort of matted together, so the pieces of bowel, loops of bowel can stick together. They can stick to the uterus, to the tubes, to the ovaries. If you find these endometriotic implants, as we call them, if you find them in the ovaries, they can cause bleeding into the ovary, and you can develop cysts that are full of old blood. And those are really pretty impossible to get rid of if they get big enough, apart from doing surgery. There are also some medical treatments available if it's less extensive. But as a consequence, because in the severe forms of endometriosis, because the tissues are sort of stuck to each other, the organs stick to each other, they become less mobile, and you can get a lot of pain with that, particularly right before your periods, very crampy periods, and also pain during intercourse. There's a second question here. What can I do to control my endometriosis symptoms? Mild forms you can control by simply taking ibuprofen or any kind of non-steroidal anti-inflammatory, aspirin, Advil, Aleve, those kinds of things. We often try to control the disease by giving birth control pills, because when you take birth control pills, your own systems are sort of shut down, and you instead get a much lower dose of hormone. So those implants don't develop as much. They can shrink and they can become kind of atrophied, and that can help with the symptoms, or at least prevent it from progressing as fast, which it otherwise tends to do, so that the older you are, the higher the likelihood that you will develop endometriosis. But you can also see it even in teenagers, which is quite astounding sometimes. Severe cases can be treated with injections of something called leuprolide acetate, which suppresses your hormonal activity to the level of menopausal women. Unfortunately, it also has side effects of giving you hot flashes, and long-term use results in osteoporosis, so it's not recommended, but it's often used as a pre-treatment prior to surgery. And surgery is then the last sort of recourse, which can often be done laparoscopically. I have a question: will endometriosis affect my sex life? And as I mentioned, it can cause deep pelvic pain on intercourse, so yes. Can endometriosis make it harder to have children? And yes, it can. It's one of the main causes of infertility, because of the fact that the tissues stick to each other, and apparently there's also some kind of chemical thing going on, so that even if you don't have extensive endometriosis, it can be harder to get pregnant. So this is often treated by simply doing IVF, which often works best in this situation. But surgery can help, and is sometimes necessary, depending on the extent of the disease, and it can also help you to get pregnant. I think I have some questions here, so let me pause with the pre-given questions for a moment and see what else I have here. Okay. What are uterine fibroids is one question. Fibroids are benign tumors of the muscle of the uterus, and they can occur in the wall of the uterus, and they can grow towards the outside surface, and even grow on the outside so that they're just connected with a little stalk to the uterus. Those are called pedunculated fibroids. They can also grow towards the inside of the uterus, and those are called submucous fibroids. Submucous fibroids can cause a lot of irregular bleeding and heavy bleeding, whereas the pedunculated fibroids usually actually have no effect on your periods. The ones that are in the wall of the uterus affect the periods by preventing the uterus from contracting during the period, so that the periods become very heavy. A related question: how heavy is too heavy for a period? This is, of course, a very subjective matter, but medically speaking, if your period is so heavy that you become anemic, in other words, you lose iron, then that's too heavy, because that will make you sick in the long run, make you weak, dizzy, tired, and if you lose iron and your hemoglobin begins to go down, you also become more susceptible to infections, and even heart attacks can happen because your blood doesn't carry enough oxygen. Those are the extreme cases, but they can sort of actually come on sort of insidiously, because over a long period of time, women tend to get used to their periods and the way they feel. And it's very common to see women with very low hemoglobin levels, which can be totally surprising, because they've adapted, to that way of feeling, but it's not healthy. So, so generally a normal period, you could say, would last from 3 to 7 days. And you really shouldn't have to change a pad more than every 3 to 4 hours, maybe a little bit more often the first day or two. But if you have heavy bleeding, in general, if you go through more than a pack of anything, pads or tampons, during one period, that can be too heavy. So you should have your blood levels checked if you suspect that that your periods are too heavy. Let's go to this one. I was told that I was going through menopause, but now I have been prescribed steroids and have been having very heavy periods. Is it possible to have heavy bleeding even during menopause? Not sure what steroids mean in this context, whether steroids prescribed for something else. We don't usually prescribe steroids per se. Hormones can be prescribed if you take too much estrogen during the transition of menopause, then the periods can become heavier, but normally we don't do that. So menopause is actually defined as not getting your period for a year. So you can't say you're in menopause until a year has gone by from your last period. During the so-called perimenopausal period, you can sometimes have periods that occur more frequently. But if they're very heavy, then there could be something wrong. Or if they occur like completely erratically, then that should be checked out. That's not normal. I've been reading that I have to change my pad every few hours, but I'm so busy at school that I don't have time. Is this dangerous? Well, it's not really dangerous. If you have one of those super pads that holds a lot, you could certainly use it until you have to change it. Of course, the blood collects in there. It can start to smell because you have bacteria that breed in that environment very easily. And of course, pads, it can chafe the skin, so you might get skin irritation from it. But it's not really dangerous per se. I recently lost a lot of weight after surgery, and I have not had my period since. Is this something to be concerned about? This is not necessarily something to be concerned about. First of all, if you have surgery, any kind of surgery can upset your systems a bit. The stress of the surgery can certainly just shut down your pituitary function, which regulates your periods for a while. And weight loss by itself is also associated with losing your period. It may come back. Of course, it depends a bit how old you are, how heavy you are. So if this goes on for too long, I would say maybe 3 or 4 months, you probably should see a physician and evaluate it. How can you tell when cramps are severe enough to seek medical attention? This is a very, very personal, subjective situation, of course. Basically, if anything bothers you, seek medical attention if you can. Because what's severe for one person is not so severe for another person. But of course, you have to bear in mind the possibility of endometriosis, and that would be a shame to let that just continue when there are treatments available, because that's something, if you leave it unattended, it can just get worse over time. So by all means, if you have access to healthcare, do go ahead and ask a doctor about it. Just because something's normal, I mean, to some extent, it's normal to have some cramps. Doesn't mean we have to put up with it if we can deal with it and be more productive and efficient and get things done and get out of the house and go to school and go to work, right? Okay, let's see what else. I had some other questions here from earlier. Let me pull them up. I had a few quick questions about menopause. We already talked about the fact that after, usually around age 50, but that could vary a lot, basically. But anytime after 40, if you go without a period for a year, then you are in menopause. But it usually happens more gradually. Of course, it could just happen like one day you have a period and then you don't have anything for a year, and that's the end of it. But typically, your periods become first more irregular, and then they stop. And then they come back after 3 months or 6 months or whatever. So anything within a year is considered normal. But basically, at some point, the woman will run out of eggs. And the ovaries, which produce estrogen and also progesterone during the cycles when you're ovulating, they stop doing that. And most women will have night sweats and hot flashes during the day. And a lot of people complain about not being able to sleep well, either trouble falling asleep or waking up very early. There's also vaginal dryness, which interferes with your sex life. Sometimes there's depression, memory problems is a complaint, and also joint pains sometimes. But about 20% of women never ever have any serious symptoms, and typically the ones who are a little bit heavier, who have more body fat, will have milder symptoms because fatty tissue contains some estrogen and retains some estrogen, and that alleviates the symptoms. What can I do about hot flashes? Well, you can try to alleviate them by layering your clothing and your bedding and staying in a cool environment, avoiding caffeine, alcohol, and stressful situations, which clearly can bring them on. But some women will require hormone replacements to be able to function effectively. I have a question here about, can you experience depression during menopause? Yes, you can. Sometimes it's just very mild, like a sort of not feeling so perky, and sometimes it's actual depression. So for women who experience those symptoms, I would recommend talking to your gynecologist. But if you need it, you may also need to see a psychiatrist, or maybe your primary care physician can prescribe you a mild antidepressant. And those often help for hot flashes as well if you're not inclined to take hormones. Or if you can't, which, for instance, if you had breast cancer, that's a no-no. There's a question about natural medications that you can take during menopause. And I would say there are many quote-unquote natural products out there. Usually they're plant-based compounds whose actions mimic estrogens, but they are quite weak and they're mostly ineffective. There's been some good studies about that. If you have severe symptoms, they're not very helpful. But most symptoms go away over time, so it could be that there's also a placebo effect of these things. There's also a great deal of confusion about the terms natural and bioidentical among women. Commercially available hormone supplements are not necessarily unnatural if you use the ones that contain estradiol, which is the form of estrogen that your ovaries have been making during your whole life. And along with progesterone, which is the hormone that your ovaries produced while you were ovulating. The main question is really how long to use these products, because earlier studies indicated that there was increased risk of breast cancer after 5 years of use, but it's not a sharp, line. It's sort of a gradual increase, and also these bioidentical products that we use nowadays are not the same that those studies were done with. They were done with synthetic hormones that were available in those days. I have a question about amenorrhea, that is not getting your period at all, and what can lead to it. So there are some genetic causes where you don't get your period at all. But if you had it and then it disappeared, there are mainly two reasons, apart from pregnancy, which always has to be ruled out if you're sexually active. The main two reasons are polycystic ovary disease and hypothalamic amenorrhea. The former polycystic ovary disease, or PCOS, polycystic ovary syndrome, is genetically determined, but sometimes it's worse the heavier you are. And again, the latter, that is the hypothalamic amenorrhea, often occurs with excess weight loss, with strenuous exercise, with illness or stress. Other causes have to be ruled out too, such as thyroid disease or pituitary disease. So it means that if you go more than 3 months without a period, you should be evaluated by a doctor. It's not good to go, if you're a young woman, to go for a long time without your period, because you end up with bone loss, which you don't notice when you're young, but it ends up being really bad as you get older, and you're much more prone to fractures. So this should be addressed if you go more than 3 months without a period. If you're on the pill and not getting a period, that's a very common scenario, and that's not a medical problem at all. I have a question about stress. How can stress affect my period? Stress can definitely affect your period. If you're battling intense physical or emotional trauma, this sort of stress, or sometimes even milder kinds of stress, can actually halt or delay your period. Again, if this goes on for too long, you should seek medical help for that. Let's see. Oligomenorrhea is another term for kind of the same kind of thing. That just means that your periods are coming less frequently, maybe once every 2 months or every 3 months or so. This is usually due to one of these disorders, polycystic ovary disease or hypothalamic amenorrhea, so the evaluation is the same. Polycystic ovary disease can affect your fertility because you don't ovulate very often, so it's hard to time the pregnancy, and it can take you longer to get pregnant. So if you're concerned about that, then you should seek help for that as well. And premature ovarian failure is not that common, but it happens, and it's considered premature when you stop having a period before your age of 40. This may be an autoimmune phenomenon, but there's no really certified cure to reverse this, although rarely it may be spontaneously reversible. In this situation, it would be best to take some hormone replacement therapy to substitute for these declining estrogen levels to protect your health going forward. Let's see, do we have more questions? My friends are skipping their periods by skipping their placebo week when they take the pill. Isn't this dangerous? No, it's not dangerous. This is sometimes even used as a medical treatment for endometriosis when you don't want any bleeding at all. What the pill, you have to understand how the pill works. It suppresses ovulation, so your own cycles are just not there. You know, your ovaries are kind of asleep. And instead of the hormones that you normally get from the ovaries, you're now getting the hormone from the outside externally by taking the pill, as well as the progesterone, which in a normal cycle, it just comes, you have progesterone around only for 2 weeks out of the month, that is after you ovulate. With the pill, you have it constantly. This is sort of mimicking a pregnancy situation where the pituitary is suppressed by these constant, in other words, not cyclically fluctuating, but constant low levels of hormones. So that's why the pill is so effective, and the lining of the uterus just ends up being kind of thin and stable, and this is why you're not getting a period. So the whole idea of having a weekly period is not really medically necessary. It was conceived by the researchers who first came up with the idea of the pill, because they thought that women would be worried if they weren't getting their period. But if you understand how the pill works, you understand it's not necessary to have the period at all. So some people still feel like they want to see that, they're not pregnant. But the pill has if taken correctly, if you don't get your period while you're on the pill, it's nothing to be concerned about, and that can happen even when you're skipping, even when you're taking the, even when you take that week's break, even if you take the placebo pills, and certainly it happens if you take it continuously. That thing, though, doesn't always work so well. There's this thing called breakthrough bleeding. In other words, the longer you take birth control pills, the more months you take it continuously, the more likely you are to have some irregular bleeding and spotting here and there. So usually it's best to take that break at least every 3 months to keep some sort of, unless you want to go around just having unpredictable bleeding, which is not so much fun. Okay, what else should we talk about? Let me see what was on my other form here. Fibroids. Yeah, we talked about fibroids already. Oh yes, we have some more questions here. Hi Jaana, after I got my first period, I have barely bled and it has not been regular at all. I am 20 years old now and I feel that my period should be regular by now. Do I need to go to the gynecologist? Yes, you should, if possible. Like I said, if you go more than 3 months without a period, it's not good for you in the long run. So that should be explored why that's happening. Make sure you don't have some other issue going on, for instance, low thyroid or something else. It could be that you have polycystic ovary disease. And this can be explored, but it needs lab tests, and it can also be treated. So yes, that would be advisable to go see a gynecologist. I have a question here that reads like this. My name is Anita and I'm 17 years old. Every month I have very heavy bleeding during the first 3 days of my period. Every month I'm afraid of leaking when I leave home because sometimes I have to change my pads every 2 hours because it's completely full. Is this normal or should I see a doctor? Like I said before, yes, it may be normal, but it could also be that you're bleeding too much. So maybe you're anemic. And even if you're not, a doctor could help you to choose something to reduce your periods, either birth control pills or the hormone IUD, which is a good way to stop the bleeding, if those are available to you. I should maybe talk a bit more about the hormone IUD. When it comes to reducing your periods, the best methods are birth control pills and hormone IUDs. And since they're still under patent, they're called Mirena and Skyla. They're good for, well, the Mirena, which is the original one, is good for 5 years. And so this is an intrauterine device that has to be inserted by a doctor or midwife or nurse. And so it requires a visit to the doctor. The IUD itself contains a little bit of hormone, which is a progestin, so it's similar to, it's the same hormone that exists in birth control pills, but you get much lower amounts of it into your system because it really only affects the lining of the uterus, so it's a local effect. And what it does is that there may be initially some irregular bleeding, but eventually the lining of the uterus becomes stable and thin and doesn't bleed. So some lucky women don't have any periods at all for 5 years. Others can have a little bit, some light bleeding. But overall, this is a very efficient way of treating anemia caused by excessively heavy periods. And as well, of course, this is a very good method of birth control. It's almost as good as sterilization. And of course, when it's in, then usually you don't really notice it. Some young women, though, if it's inserted in women who have not had children, can have more bleeding and cramping, and sometimes you have to remove it because they never really get used to it. The uterus is much smaller before you have a baby, but after you have a baby, this is a very well tolerated method of birth control by almost all women, and also a very good way of controlling heavy periods to the point where surgery is not necessary in most of these cases, unless you have like large fibroids or some of these submucous fibroids, in which case you can't really use this method. So if you have a chance to use this is really something to look into. In the United States, it's usually now covered by insurance as well. The other IUD, which is called Skyla, is basically the same thing, but it's smaller. It's been specifically designed for women who have not had children, but it's only good for 3 years, and there's less hormone in it, so you don't get as good cycle control with that as with the Mirena. But it might be worth a try if you can't use the Mirena. I have another question here. Jaana, during 5 out of 7 days that my period lasts, I have to take painkillers every 6 to 8 hours. I feel this is not good for my health, but the pain is too bad, so I can't avoid taking the pills. So I would say taking those painkillers is not necessarily bad for you, unless you have a stomach ulcer or get stomach symptoms from them. But it sounds like you could benefit from managing your periods. It could even be that you have endometriosis, so I would definitely try to see a doctor. I have a question here from Ethiopia. Hi, Jaana, I would like to know what the consequences of a non-proper period management are. I am from Ethiopia, and we don't always have access to clean and safe sanitary products. The main problem with lack of sanitation is really that you can develop rashes externally and bacterial infections, perhaps possibly even vaginal infections, but it's more of a discomfort than a major health risk. I have a question here about, during the last 2 years, I have been suffering from strong headaches, maybe migraines, every month, right before I have my period. Is it possible that there's any relation? Should I go to the doctor? Yes, there is something called menstrual migraines, and they typically happen when your estrogen levels decline just before you get your period, and those can be pretty bad. So if you have a possibility of seeing a doctor, I would definitely do that, because one can manage these. I have a question here. Is it true that if I take the pill for too many years that I risk my future fertility? This is a common question. It's not true. If anything, the pill may protect your fertility, because if you don't take anything, then infections are more common. Cysts on the ovaries happen more frequently. Endometriosis can happen and become worse. So the pill protects you against those. When you go off the pill, you just go right back to whatever your cycles were before then. Of course, the reason many women have the perception that their fertility is worse when they go off the pill is because they're much older. Some people stay on the pill from age 60 until 36. And of course, your fertility is not the same at age 36 than it was earlier. So, but by itself, the pill does not interfere with fertility. I have a question here about, somebody told me that the amount of blood I lose every month is small and that I would never fill my menstrual cup entirely, but this has already happened to me twice. Is that normal? It can be normal. It could be that you need to empty your cup more often. But if this is difficult, or if you bleed so much as to be anemic, then it would be better to check into this, and maybe you're one of the people who could benefit from hormonal treatment to reduce your flow. And a question here about the pill. Sometimes when I bleed, sometimes I bleed even when I'm taking the pill continuously. Is that normal? Is there something I can do about that? I would say you need a different pill. So you need to go back to the doctor where you got this and be evaluated. There are many different types of pills, and sometimes by tweaking the dose of one hormone or the other, or the type of hormone, one can correct this problem. More about the menstrual cup. I tried putting a menstrual cup in, and I had horrible pain when I took it out. I'm a virgin, but the directions never said that virgins shouldn't use it. So what was that pain? Well, my guess is you may have had a little tear, maybe in the vagina or maybe the hymen. When you're a virgin, your vaginal entrance is, of course, smaller, but it varies quite a lot. So some people can't even use tampons. And inserting the cup requires a little bit of space. And when you pull it out, of course, the diameter of the cup may be larger than the diameter of your vaginal opening. So yeah, it could be that you tore that sort of similarly when you have intercourse for the first time. That could be that that's what happened, and that's going to heal by itself. You may have a little bleeding, but it usually heals up by itself. I have to tell you something. Occasionally it happens. I get young women in the office who come in with their mothers. The mothers can be very concerned that there's something wrong with the daughter, and then I tell them that this requires a pelvic exam. And the mother will say something like, oh, but then she won't be a virgin anymore. And so if you're a young woman watching this, please tell your mother that just having a pelvic exam does not make you not a virgin. Intercourse is something quite different. But in order to fully evaluate someone with a bleeding problem, for instance, you normally have to insert a speculum, just look at the cervix, and then 1 or 2 fingers in the vagina, along with simultaneously feeling from through the bladder, on top of your belly, to see if you have any tumors or cysts on the ovaries and things like that. I see these questions are coming sort of like completely erratically here on the side. So, okay, so I have a new one here. My period app says I'm ovulating, but I'm having spotting. Can that come from ovulation? That can, yes. It's what happens is just before you ovulate, your blood estrogen levels dip a little bit, and anytime they go down, you can shed a little bit of the lining. So that's why some people have a little spotting right before they ovulate. Okay, here we go. Should I be taking iron supplements during my period? I'm not anemic, but I was told it might make me feel better. Well, you could take iron supplements. I'm not sure once you have normal iron levels, if taking extra iron is going to make you feel better. Might be a placebo effect. However, it depends on, you could be not anemic, your hemoglobin level could still be normal, but if you bleed a lot, your iron stores could be low. And what happens is that first you deplete your iron stores and then your hemoglobin level drops. So if you do have heavy periods, it might be better to take some iron supplements and to prevent that from happening. What can I do to make my period regular? This is a very, very general question. It depends so much on your age, And, you know, like I was mentioning before about polycystic ovary disease, about hypothalamic amenorrhea, those are the two most common causes, but you might also have thyroid disease. So in other words, there's no way to answer this question really, apart from you're going to see a doctor and having some tests done. Okay, here we are. Whenever I'm on my period, I get really bad existential crisis, and I'm not sure why. Is there any explanation for why that happens? There are a lot of women have sort of emotional ups and downs during your cycle. It typically happens, for some women it happens right before they get their period, and that's called premenstrual tension or premenstrual dysphoric disorder is another term for it. And during a period, your estrogen levels are the lowest they are in the cycle, and some women just feel really bad when their estrogen levels are really low. So maybe sometimes one of those higher dose pills, we don't really give super high dose pills anymore, but maybe not the lowest kind, but you know, maybe just a birth control pill might help you. It might be worth trying. Anyway, otherwise, if you don't want to do that, you know, you could, of course, if it's really serious, you might need, you know, like an antidepressant or something. But oftentimes when it's just limited to strictly a certain time in the cycle, you can manipulate that. You can improve it with hormonal treatment. Again, it depends a little bit on your age, so you should definitely discuss that with your doctor. Why does it say select here? Do I have to punch these buttons? I don't know why it says select anyway. Here's a question. When I get cramps, I get severe chills, nauseous, and lightheaded. But my friends say they get the same thing, so I don't know if it's serious or not. Well, it's actually, unfortunately, kind of normal. So the best thing to do is either try to find ways to manage that, or again, you know, to go discuss it with your doctor and see if you want to start using something, a Mirena, maybe a pill. Those definitely help with all of those as well. Here's a question about, I'm 20 and had jaw surgery about 2 months ago and just got unwired 3 weeks ago, and I've been really stressed and I had strep. Now my period is 5 days late and I took a test and I'm not pregnant. Should I see a gyno or could it be stress? It could definitely be the stress of the surgery and everything else. So 5 days late is not that serious. You can definitely wait if you're sure you're not pregnant. And like I said before, you know, you can go up to 3 months without a period. It's not really serious. Most likely it'll come back. If it was normal, regular before, it'll go back eventually to the same pattern. Here's a question from a 14-year-old. I'm 14 and just started my period in December, and this month I only had my period for 1 day. Is this normal? Yes, it's probably normal as long as you're not sexually active and could be pregnant. Most likely this is normal. When you're young, in the first year in particular, the periods can be really irregular. So don't worry too much about that. Most likely it'll settle into a normal pattern after the first year at the latest. If not, then at that point you could talk about it even with your pediatrician. They're quite used to handling these problems in young girls. Here's a question about tampons. How long should tampons stay inside your body? Can you sleep in one or will I get toxic shock? Okay, so Toxic shock is actually really rare these days. It was more common in the 80s when the tampons were made of different materials. Toxic shock syndrome can also happen for other reasons. It's not caused by tampons per se, it's caused by bacteria, usually Staphylococcus aureus, which you can get other ways as well. But that said, it's probably not a good idea to leave a tampon in very long. I would recommend using pads during the night and tampons during the day, and only during the heaviest part of your period, so that when you get to the light days, you can maybe just use a little, light pad or something. You don't want the tampon really to be there where it's all dried up. It also gets very hard to get out, and I've often had to remove tampons that were stuck because people couldn't get them out. Here's a question. At what age should you start seeing a gyno? So if you're seeing a pediatrician, you probably will have gotten your HPV shot, which I highly recommend. And if you don't have any problems, such as not getting your period or if you have heavy periods or something, then of course you should see a gynecologist. But if everything is normal, you don't have any problems, don't really have to see a gynecologist until you become sexually active, or perhaps you should see them before you become sexually active if you're planning, so that you can get on some good birth control. Otherwise, we start doing pap smears at age 21. Those are done to screen for cervical cancer, so that condition is really, really rare before age 21. Even after age 21 it's rare, but we try to catch precancerous conditions, which are caused by HPV. So if you're not sexually active and at risk for getting HPV, then you don't really have to see a gynecologist until, strictly speaking, age 21. Do we have any more? Oh my gosh, we only have 10 minutes left. There's a what of questions? Repeat questions. The what? I think you would be better explaining that. Because I haven't been that involved in the campaign itself. So I think you're better off talking about that. Okay. Can we we're going to switch now and put Dilara on here to talk about the campaign. Thanks for your attention.
Hello. So we at the Let's Face It Period team would just like to thank Dr. Jaana so much for coming in and speaking for a whole hour about period problems and menstruation problems and answering all of your questions so well. She's doing this, of course, as a part of the hashtag Let's Face It Period campaign that has been running since September 1st when we launched it. And we're trying to call attention to the problems of menstrual taboos that are affecting girls around the world, from having access to menstrual products, menstrual education, and then because of that, they're not able to get an education or participate in their day-to-day lives. So we're working with 5 organizations in Kenya, Tanzania, New York City, and South Sudan. And we're working to try to get girls access to these menstrual products, menstrual education, and also being able to live in a world without these menstrual taboos. So we would encourage everybody to participate in our Red Lipstick Challenge. Put on the red lipstick, take a selfie with the hashtag Let's Face It Period. And once again, we just want to thank Dr. Jaana, and thank you.
Sorry, I forgot my lipstick. I forgot my lipstick, I'm sorry.
Bye-bye.
Bye.